Welcome. Thank you for joining me here tonight. If you have come here before, you know that this is the 16th town hall that I have hosted over the last year and couple of months. Trying to do my best to make sure that we as a community have access to accurate information from people who are bringing us a lot of experience, and in the case of today's panel, also have been in really important roles in helping us navigate and make decisions on how to keep each other safe. Before I introduce our amazing panel, I do want to say to anyone who's watching here tonight and to my neighbors throughout the community in Cambridge, if you have lost a loved one who has lost a loved one to COVID, you've experienced COVID, or you've cared for somebody who had COVID-19, I just want to say that I am really sorry. Words cannot substitute the magnitude of grief that we have experienced collectively and that many are experiencing privately and still grappling with. For those of you whose lives have been upended by this pandemic, whether that's been because you have been experiencing COVID, or you've lost a job, or you're just watching your child struggle with the pandemic, and you're grieving and just missing a sense of connection of life as we once experienced it. I just want to say again, I am sorry, and I'm also really hopeful. I'm hopeful that our life will begin to, and has for some, begun to move forward in a different way that feels a little bit better than where we were a year ago at this time. We also know that this pandemic has hit some members of our community much faster and much harder. And I can't imagine ever talking about this moment of time and this pandemic without thinking and acknowledging about the impacts of structural racism and economic inequality and what they have done and how that has impacted people in such a disproportionate way. Because we only have one very short hour together, I'm going to try to move us very quickly to some introductions. I have some really amazing people who've joined us here, and I want to introduce you to them, and then I want to quickly just move on to your questions, because this hour goes by really fast, and many of you spent a lot of time sending in questions, so thank you. The panelists that I brought together are people who are really uniquely familiar with emergency management, with developing vaccines, and with being involved and looking at how we distribute these vaccines and really how we have navigated safely through a variety of public health protocols. I want to start with an introduction to Secretary of Health and Human Services, MARYLOU SUDDERS. Secretary SUDDERS was appointed by Governor Baker to head the command center, which is really trying to have one place that would be in charge of really taking a broader look of how does the state move together, row in the same direction to ensure that all of the choices and the decisions we're making really do try to build as much resiliency and safety as possible. Secretary SUDDERS oversees 12 agencies. In addition to also overseeing so much of our COVID work in Massachusetts, she oversees 12 agencies, including Mass Health, is responsible for 22,000 public employees who are delivering essential services that touch at least 1 out of 4 residents in our state. She joined Governor Baker's cabinet in 2015 and has been advancing strategic policy priorities, including restructuring Mass Health into a population-based health coverage system, reforming the child welfare system, addressing the opioid epidemic, integrating physical and behavioral health care, and strengthening community-based services. I just have to say, you'll have a chance to hear from her in a second. I can't imagine having anyone better at the helm right now, and certainly someone who has dedicated her life as a social worker and who has an incredible track record of working relentlessly to improve the lives of many in our state. So I'm so happy to have her here with us today, and I'm happy to have her at the helm here. I also want to introduce Dr. Asad Sayed, who is the CEO of the Cambridge Health Alliance. He was named Chief Executive Officer in January 2020 after serving as the interim CEO and the Chief Medical Officer of the Cambridge Health Alliance since 2013. Dr. Sayed's leadership has been a critical component of CHA's growth and success over the past decades. Before being named the Chief Medical Officer, he served as the Chief of Emergency Medicine and Senior Vice President of Primary Care. He has shown leadership and commitment to strengthening our behavioral health services and systems to address social determinants of health. He plays a key role in CHA's commitment to the community it serves, including working in Cambridge as the co-chair of the city's opioid working group, and helping to establish recommendations for strengthening the city's response to the opioid epidemic. Additionally, he serves as the chairman of the CHA's chief councils and president of the CHA medical staff. He continues to serve on the faculty at Harvard Medical School and has really published quite a number of papers and publication based on his research and his work. Personally, I can't think of a better person to be at the helm of where we are at this moment as well. He has, knowing he just came into this role just before this pandemic has hit our state, having somebody in emergency medicine, having somebody whose life work has been a deep commitment to understanding that, again, the social determinants of racism and wealth inequality are often the biggest threats to living long and healthy lives. I'm so grateful that at this time, he is at the head of the CEO and the head of the Cambridge Health Alliance. So I'm so happy and grateful for his work. I also want to introduce you to Dr. BRONWYN MACINNIS, who is the Director of Pathogen Genomic Surveillance in Infectious Disease and Microbiome Program at the Broad Institute of Harvard and MIT. She's also, she's a scientist at the Institute and co-leads the Institute's multidisciplinary global health initiative and is a visiting scientist at the Harvard Chan School of Public Health. Her work has been to leverage and integrate the expertise and resources of these institutions to drive innovative infectious disease genomic research and to translate this to a practical application for global health. Her primary focus has been on developing deployable genomic data and tools for malaria surveillance and viral outbreak response, building local capacity to integrate these into routine practice in lower resource countries. She's also served as a technical advisor to the World Health Organization to develop genomic data use cases and data sharing guidelines for their global pandemic preparedness strategy. So much of her life's work has led to how the Broad has become an integral partner both to the state and I would say to the country. I would be remiss if I did not acknowledge how grateful I am for her leadership and her work, but also that the Broad Institute, many of you know, Eric Landers is a Cambridge resident who is the founder of the Broad. And if you don't know Eric, you know his wife, Lori Landers. But very quickly at the beginning of this, when we had no leadership at the federal level, and in fact, the leadership that did exist at the federal level, in fact, continued to create a lot more harm and damage to many of us in this country. Broad very quickly jumped in and actually started modeling what government should be doing, whether it was their ability to develop a rapid pilot test for surveillance, to partner with the state on trying to create more testing initiatives to stop the spread, or helping private colleges and elementary schools figure out how to do testing. So I'm so grateful to have you here, and I'm grateful to all of your colleagues at the Broad Institute for their incredible work that I will never forget. Quickly, I want to say hello and thanks Dr. Paul Bittinger, who is here with us today. In addition to many roles that he has, he also chairs the COVID-19 Vaccine Advisory Board for Governor Baker. So it's really exciting to have you here with us today. He holds the Mass General Hospital's Endowed Chair in Emergency Preparedness and is the director of the Center for Disease Medicine and Vice Chairman of Emergency Preparedness in the Department of Emergency Medicine at Mass General. His entire career has been about how do we respond to emergency disasters around the world, whether that or here in the United States, whether that's Katrina or where we are today. And I know that I have gotten to know you a little bit, but everybody I know has talked about what an incredible resource and steady hand you have provided the state. So thank you. With that said, I really think it's important people know who you are and why I've asked you to be here and how incredible it is to have you spend 1 hour with us. This is Cambridge, so we have a lot of questions, as you can imagine. But I want to just start off with saying thank you all for being here. And Secretary SUDDERS, before we get into questions, I can't thank you enough for where you are and the work that you've done. I don't know anybody, you know, all of us work a lot. I don't know that you've actually had 5 minutes off in the last 13, 14 months. And you seem to have more hours in a day than anybody I know. I actually envy that. And boundless energy to figure out how to problem solve. So thank you.
Thank you, Madam Chair. Thank you, Representative Decker, and to everyone else. And I'm going to be very quick because part of the questions help us also understand what we need to do more of, different of, better of. Just a shout out, since I am a Canterbridgian, I want to give a shout out to Cambridge Health Alliance. And I actually brought Representative Decker my most recent information that I got from the city in multiple languages about Get the Vax. So Cambridge does a very good job of communicating with its citizens. And Eric Lander, Paul Bittinger, Rochelle Walensky, who is now our CDC director, have all served on our medical advisory board, giving us the best science that we need to move forward. And the Broad Institute is probably the best investment in working with Eric and the Broad on pool testing, fast testing. We're the fastest tester in the United States because of the Broad's infrastructure. And Dr. Bittinger has been really a source of truth for us as we work through this together. And Assad, just grateful for all that you do in the city and the new collaborations around really pushing out vaccines, not pushing out vaccines, making vaccines as accessible, meeting people where they are. So I'm going to turn it back to you. Thrilled to be here tonight as we continue to find the path to our new normal.
Thank you. And as I said, I'm hopeful. I keep reminding people when they want this to be 2019 that already where we stand today for some is just a little bit better than where we stood a year ago. And I continue to believe with the leadership, with new leadership at the federal level that believes in science and believes in caring for people wherever they are and whoever they are, and continued leadership right here in Massachusetts, and certainly in Cambridge. We are really lucky to have CHA, the Broad, and incredible city leadership here at the municipal level as well. So I'm going to jump into questions, and instead of reading them on my computer, because I like to see the faces of the guests, and I can't do both, so I'm going to do the hard thing here and read, but we're going to jump into them. What precautions should a vaccinated individual take when socializing with an unvaccinated individual if they are dining inside or outside? Does it make a difference? I think everybody should take their mics off and jump in.
Let me try to take a stab at this. First, I want to thank you, Representative Decker, for bringing this forum and creating this space. That's absolutely critical for everybody. I wish that this is broadcasted more broadly than through Cambridge, because the information that's shared, well, even widely internationally, because the information that's shared here is absolutely critical. I've had the pleasure of being a guest on many of your town halls and being actually a listener. So sometimes I sneak in and listen, and you guys do a wonderful job. And I learn a lot by being here. And I'm very honored and privileged to be here with Secretary SUDDERS, Dr. MACINNIS, and Dr. Bittinger. It is great being here. To answer your question, we need to continue to practice appropriate etiquettes, at least for the foreseeable future. What we've been preaching still is true today. And particularly if we are with folks that are at risk, folks who are not immunized, or even folks that are immunized. Remember, the vaccine is only good for a little bit in the low 90s, depending on which vaccine you're doing. There's still a likelihood that we can still get infected, and we may not be as symptomatic, but we can carry the actual infection and give it to other people. So my advice to my family and my colleagues and my friends and my patients is for the foreseeable future, continue to wear your mask, continue to practice social distancing to the extent that you can, continue to sanitize your hands, and really be very thoughtful and use common sense.
So you've been vaccinated, and your visitors have been vaccinated, and maybe one's not. Can you still go inside and see each other?
Today, if this is not in the hospital, obviously. In the hospital, we still strictly practice 100% the same precautions that we did a year ago, or 3 months ago, or 6 months ago, and that includes our visitors, our patients, our staff, etc. And that's very important to maintain a very healthy and very safe environment for our staff and our patients. But this is for the audience and in a social environment where people are vaccinated and they are low risk. If they are practicing appropriate distancing, it is okay not to wear the mask all the time. I would be curious to hear from everybody else on the panel, but that is the advice that I give.
I think one thing I might jump in with, and I would really like to echo Dr. Saya's comments and thank Representative Decker for just all your tremendous advocacy and for these incredibly informative forums. It's really an honor to join you all. I think, you know, one thing that it's really important to note is what's changing. Both the state just recently updated its guidance, as did the CDC, about outdoor behaviors, and it's a great reflection of the progress we're making with vaccination, and it shows how we're able to get back closer to where we were safely as more and more of us get vaccinated. First, it's really important to understand how different outdoor and indoor environments are, that we know that the vast majority of COVID transmission happens in indoor environments, and that when you have vaccinated individuals who can distance, who are not in crowds, and that you can keep a bit of distance from one another, that you can get together without masks on. And that again is because we're changing prevalence of the virus in the community. It's because vaccination is protective. We have great data that just came out recently that says that 94% of vaccinated older individuals are not hospitalized, don't get hospitalized with COVID. Great data. So we're seeing some changes. And again, I think the fact that we can get together outdoors without masks now, unless we're in a crowded setting, is a reflection of the progress that we're making.
Thank you. I'm going to jump into a next question. Dr. MacInnis, maybe this is a good question for you, because this, early on, I heard of, this is not me asking, this is a question that came through. I heard a lot of concern that squalene was needed for vaccines and that this came from sharks. Can you tell me, is shark squalene part of the vaccine or vaccine development process?
Well, first of all, I'd just like to echo my colleagues in thanking you, Representative Decker, and the community for these excellent questions. I have to say, unfortunately, I'm not the best person to answer that question. I don't know whether shark squalene is part of the vaccine formulation. I'm not sure if my other colleagues can speak to that in particular.
I do have a little bit of knowledge on this one, that there are vaccines not currently either being developed or used here in the United States, but that did use the squalene to get the fat particles necessary to potentially deliver the vaccine. But none of the 3 vaccines that are under emergency use authorization here, EUA, in the US, so the Pfizer, the Moderna, the J&J, use or derive shark squalene at all. So people can have some reassurance that none of those products has any impact on the shark populations.
Thank you.
Thank you. So I have a couple of questions that I'm going to combine because they seem to be getting to the same thing here. Has the state considered making COVID-19 vaccines mandatory for college students? Will this be mandatory for students in the fall who qualify? I mean, I assume they mean for 16-year-olds and up, or if it gets lower to 12-year-olds and up. Will, given the density of Cambridge, these are several questions. People are really concerned about that, ensuring that all the college students who can be vaccinated are vaccinated. We live in a dense community. And will we require schools to have both students vaccinated and teachers vaccinated? So that's kind of several questions that were put into one, that I'm putting into one.
So why don't I start, and I'm sure we can all.
There's a will we and should we, I guess. Maybe there's 2 parts of that.
So at this time, there's not a move to mandate vaccines, in part because of the EUA, the emergency authorization status actually requires, as part of the authorization, that these be voluntary. What we're certainly seeing is individual universities, I mean, we've seen it to date, saying to come back to school in the fall, you'll need to be vaccinated. And I think we're going to see over time, employers and others make individual decisions. I think I think this is going to continue to evolve, Representative Decker. At this time, because we believe in the safety of these vaccines, right? They're safe. that we're doing everything possible to encourage people to get vaccinated. And when you mandate it, I think for people who are hesitant, I think it actually increases hesitancy for someone who's on the fence. It's like, well, if it's so safe, why are you mandating it? So I think this is going to continue to evolve over the coming months. But at this point, it is a bit of, I think the mandatory status in Massachusetts is going to evolve. But I don't know what my colleagues have to say about this.
Yeah, I totally agree, Secretary Sudders. And at this stage, I think the best thing we can do is continue to educate, continue to provide transparent information, rely on science, have programs like this that speak to the people's hearts and people's minds, and make sure that people hear various opinions, particularly opinions from folks within the community, folks that look and sound and speak and tell stories like everybody does, and create trust that this is absolutely safe. I truly believe this. All my family is vaccinated, and I encourage anybody who qualifies to get vaccinated to protect yourself, to protect your loved ones, to protect your families, to protect your communities, and to help us get this pandemic under control.
Thank you, Dr. Say. CHA has been doing an amazing job, not only here in Cambridge, but to remind people that we also serve Everett, Malden, Revere, Chelsea, Somerville, a lot of the very hardest hit communities, which were disproportionately communities of color and immigrants and low-income families. So thank you for your work there, and it is about building trust. I will just say that somebody who's very near and dear to me in my life, who's 92 years old, absolutely did not want this and was determined. And it was very stressful because there were other family members around who were terrified of actually bringing the virus into their house because they couldn't prevent, they had to go into health care for her. It was her 90-year-old best friend who convinced her to do that, right? So when we talk about sort of who are going to be the best ambassadors, nobody else could do it, and there was no level of guilt that was going to make that happen. It was her 90-year-old best friend who she finally agreed with. While we're on the issue of one of the questions that I know many people have, myself included as a parent, currently Pfizer is the only one that is authorized for 16-year-olds and up. Do you have any sense of when the others will be authorized, not only for 16-year-olds, but do you have any insight to when they will actually become more available for younger children? Do you have a timeline, and do you think this will correspond with school reopening?
So my best intel at this moment is that the emergency use authorization for youth 12 and up is imminent, and imminent meaning early May. I believe we will see the emergency use authorization for Pfizer,
okay,
for 12-year-olds plus. I don't know what the status is of the other clinical trials, but I was on a call earlier today with the federal government, and I have to say this federal government's been completely transparent with the information that they have. And when I said I was sort of planning for mid-May, they're like, no, you could probably be planning earlier than that. So I think we're expecting it any moment now.
How exciting that people are hearing about that right now on this town hall. Thank you, Secretary Sudders.
I don't know. Paul may have even like more current information than I do.
No, I'm sad that it doesn't have a breaking news crawl across the bottom of the TV. But
we can fix that.
Exactly.
That's great. Looking forward to see the data.
Yeah, that's exciting. Okay, next question will be here. Well, I think one of the things people are thinking a lot about are if you have a preference, should you choose one of the mRNAs, which we know is Moderna or Pfizer, and should people be afraid of Johnson & Johnson? We have, both here in Cambridge, or all three, and so people are, worried about which one they should take.
Let me try.
First one you can get.
I truly believe that all three vaccines are extremely safe. And I personally would not have any issues getting vaccinated with any of the three vaccines. Having said that, the science behind the mRNA and the Johnson & Johnson vaccine is totally different. It's a totally different vaccine, it's a totally different composition. One works differently than the other. And the science behind the Johnson & Johnson vaccine, the way it's constituted, there is a slightly higher risk in certain population of clotting, particularly in the brain. That's what we worry about. And we can talk medical terminology, but that's not the place for it. But for the normal population, particularly population with lower risk, it is extremely safe. And I have no problem, myself or anybody in my family, get the Johnson & Johnson vaccine today.
So let me be very granular about this. I received J&J a month ago, probably. It's been one long day since a year ago, March. So never trust me on a date anymore. I received it, like I said, a month ago. I'm completely comfortable having made that. Received J&J, and I would do it again tomorrow. I believe in the science, and while two of them are the mRNA, the Pfizer and the Moderna, J&J is safe. And I appreciate the fact that the federal government paused to look at the data and then made the statements that they did. So I am here to say, I took J&J, happy to do it, and I would do it again tomorrow.
And even though the J&J vaccine is not based on the mRNA technology, it is based on well-vetted, widely used technology for many previous vaccines, and so it's not a negative that it is not an mRNA vaccine. It's just a different vaccine strategy, but one that's well-vetted and widely used.
I know plenty of people by now who've had J&J and women under 50 who've had it, and again, can you just remind us what the statistics are? Because they're so low, but I think it's important people hear that, right? The pause was good. It shows that it's working. It shows that, the federal government and the FDA is paying attention to safety protocols. And we wouldn't even notice this, except we're in a pandemic, so we're all watching very closely. I want to know how many epidemiologists are growing up right before our eyes. I think about that. But can you just give us a little bit around sort of statistically?
Yeah, Dr. McInnes, do you want to go, or would you like me?
No, I don't actually know the statistics off the top of my head.
So the risk in the general population is about 1.9 per million, and the risk in the women aged 18 to 49 is about 12 per million, or 13 per million that would have this clotting syndrome. And that's on par with the risk of death in that age range. And so I really want to underscore what's been said, that these are incredibly well-studied, well-vetted vaccines, and that the pause represents really such a victory of safety, that we are constantly looking for side effects really whenever they're extraordinarily rare. But there are many medical therapeutics that we use that have a much higher risk of adverse effects, and that anyone who has a question about their risk should absolutely feel free to speak to their clinician to have a good discussion. But I think we have administered more than 7 million doses of Johnson & Johnson in this country, and really the fact that we picked up on that, we studied this rare possible association, and that we're still aware of it, means that we're doing exactly what we should do to have the highest possible bar for safety for these vaccines.
Thank you, Dr. Bittinger. I think you make an important point too, is that there's plenty of people who today are taking medications that are important and life-saving that also have quite a few risks. Just, open up a magazine or turn the TV on and it's like, but they were actually given out like frequently because in fact, more of the time, the majority of the time, they actually do what they say that they're going to do, and they help people stay healthy. So that's important to remember. And I always like to remind people that the risks of COVID, we know what actually that is. And I was talking to a friend last week whose friends caught COVID, no underlying health conditions. The husband is fine. His 52-year-old wife was buried last Friday. I was at the State House just recently. We did the budget this week. I was talking to another colleague. He has two people who are very close to him, and both have passed away. And so this is where, you know, as much as we're all tired of this, it's not tired of us. And the vaccines are what are allowing us to actually, you know, navigate with a lot more ease of what it means to potentially catch this and not die and not get very sick. So,
and one quick
I would say, sorry.
I was just going to give a quick plug on the point that for some folks who are more needle hesitant than necessarily vaccine hesitant, the J&J vaccine is a one and done opportunity. So if, you know, for any reason that is appealing, it does have that feature if you have access, if that's the, you know, the opportunity you have.
Yep.
The other thing I would just reinforce what Dr. Bittinger said, which is if anyone has concern about whether they have a pre-existing condition or the like, is to call their healthcare provider and to just talk through with them concerns that they may have. And I think that's really the message, is if anyone has concerns about which of the vaccines, particularly if they have a pre-existing condition, they should call their healthcare provider.
So I'm going to out myself and say that I didn't talk about this until I had it. I was terrified of getting this vaccine. Not because I'm terrified of vaccines. I actually have all of them. You know, I'm terrified of the flu shot because I get that little itchy, bumpy thing, right? And I have allergies. That's really, the anxiety wasn't completely based on, no, I have a variety of allergies and concern about reactions. I called my provider, which is CHA, and you know, it was amazing. Actually, the shot was less painful than the flu shot. And I'm going to go ahead and say I'm one of those people. I had no effects on either shot. The worst effect was the anxiety I had waiting to see. I literally woke up in the middle of the night going, am I sick yet? Do I have a fever? I didn't. I was fine. So to those of you who are worried, it's okay to be worried. I also knew I never had a question in my mind that I would be getting it because I'm far more afraid of not being around to care for my family in the condition that I want to be. So thank you for that. We have a lot of questions, so I'm going to keep going here. Have you been monitoring the development, collective view here, on the COVID-19 variants? What can you tell us about the potential impact these variants may have on our healthcare system? And then I'll combine another question that asks us, what are we doing differently to bolster us from these variants, and will a booster shot actually be needed soon? And will it be combined with the shots that we've already had to protect us from these new variants? Two good questions.
Well, we know that this virus is prone to mutation. That's how it came to existence from the beginning.
And that's how viruses work too, right? So
Absolutely.
It's not so special.
Exactly. So these variants, this is the natural evolution of a virus. They do mutate. And some of these mutations, you know, make it through and become more dominant. And that's what we call variants. And that's how this virus started at the beginning and will continue to mutate. As the more it infects people, the higher the likelihood it's going to mutate. The longer it's around and infecting people and regenerating, the higher the likelihood it's going to mutate, which is important to remember. The one way that we can the most important way we can manage these variants is with vaccine and with practicing appropriate etiquettes, because the one way that we can prevent it from mutating and creating new variants is by decreasing the probability of infection and infecting other people. So it's important to think about it that way. So if you're worried and scared about variants, get vaccinated and continue to practice appropriate etiquettes in here and be part of the solution. That's very important. Now, the variants that already exist today, I'm sure there are tons of other variants we don't know about. Many of them are less infectious than what we see. The ones that are more concerning are the ones that we know about. Doesn't mean that the virus chooses to mutate in a way to be more dangerous. The good news is, you know, all the variants that exist today are concerning, but they are not concerning to a point where we think that, one, that we know that the vaccine works, and two, we know that the current treatment work, and three, we know that the current precaution that we advise people work. So continue to practice the appropriate precautions, get vaccinated. Let's get this pandemic under control.
Thank you.
That's right. And I'll just add that we are, in addition to that, we are working hard to look for these variants in our communities and to understand how they work and what effect, if any, they'll have on transmission, the spread of the virus, or the severity of disease, or their ability to influence the efficacy of our vaccines. And that's something that I think the variants that have been kind of brought to our attention over the past few months have done is that they've really kind of instigated a national and a global response to do this even better. And so we are now, as a state and as a country, working collectively across the state lines across the country and around the world to be doing this type of surveillance so that we can get ahead of this problem, and if in fact variants arise that do influence vaccine effectiveness, we'll be able to identify them and contain them and stop them quickly rather than spreading wildly without us even knowing it.
And
What about the boosters? Go ahead,
Well,
Secretary.
just a little shout out. I think my friends at Broder are being a little modest, because up until really recently, in order to really test for the variants, there were 3 CDC labs, and the Broad has now the ability to really do the sequencing of these variants much more quickly than sending them out to the 3 national labs. And several of our other academic medical centers in Massachusetts are now able to test. So one of the things about when you look at the data for Massachusetts, you may see actually higher rates of variants being detected because, one, we test in Massachusetts. And one of the things I want to put out there to everybody,
It's important to hear.
if you are worried that you've been exposed, go get tested. And then we have places like the Broad that are sequencing for the variants, and we get the information much quicker. That really should be assuring to people. And to just something else that my good friend Assad said is, if you're worried about the variants, get vaccinated. That's our best defense.
Great. Thank you.
I would say,
Bittinger?
yeah, sorry, forgive me. I just, wanted to underscore, I think Dr. McGinnis is, and the Broad are yet more reasons to be glad we live in Massachusetts, because we have scientific capabilities and scale that so few places have and put us in a leadership position. But I think you were asking the question about boosters, and we just don't know yet. There really are 2 important questions that guide whether we'll need boosters. And one is how long immunity lasts after vaccination. And we need a little bit of time. We need more study to know. But just like we need a new flu shot, some of it has to do with changing immunity, but some of it has to do with how the virus itself is changing. And if indeed there is that evolution, there's that change in the virus, like we see with flu and like we see with many viruses, those are the 2 reasons that we could need a booster. I would say a lot of folks think we may end up needing boosters going forward. But that puts us in a future where each fall we get a flu shot, we get a COVID shot, but it keeps us protected and it keeps us from having to go through what we've been through in this terrible last year. So it's not that scary, other than that maybe we need 2 shots. But again, the vigilance that the extraordinary places like the Broad are helping us with to identify new variants, and then the ability to engineer a new vaccine as a booster, we're in pretty good shape for.
Thank you. We only have about 20 minutes left, and I have far more questions, a lot more questions here. But one of the questions I think it's important to get to is the question of equity. There's been a lot of concern about what are we doing, what have we been doing, and what are we doing to ensure an equitable rollout of vaccines? What is the administration continuing to do to meet the needs of those who've been disproportionately impacted? Where does Massachusetts fall nationally when it comes to equity vaccine distribution? And where does it fall within how do we compare ourselves to our own population? I think there's a lot in there. So Secretary SUDDERS, do you want to start with this one?
Sure, thank you for
that. I know it's
that.
something you think about every day.
We do. and we try to put out data to also help inform what we're doing. So from the very beginning, and again, this set us apart from other states and under the leadership of Paul and the Vaccine Advisory Board that we asked to come together to advise government, right? Not government decide, but have folks outside of government advise us, was always around preserving life, protecting the healthcare system, and addressing equity. And that has been our our 3 guideposts throughout the vaccine distribution. We have identified the 20 most disproportionately impacted communities with very targeted resources for them, both around canvassing, hesitancy, but not state government telling those 20 communities what it is they need, but sitting with them for them to tell government, state government, what resources they need. We have made vaccines just available, if you would, like extra doses available for those communities, for them to decide where they need to focus at, which is a different role for the state saying, this is what you need to do. It's like, we have to listen hard. What I can tell you is we have a whole lot more work to do in this space. So this is not boasting by any means. We beat the national averages far and away for indigenous populations, individuals who are Black, brown communities, Latinx. But I would say that the national standard is like a low bar. And so we need to continue to iterate. And what you will see going forward is sort of the devolution of sort of mass vac sites, which served a purpose. And really, like the regional collaborative with the Cambridge Health Alliance with Cambridge, is pushing vaccines much more granular now. The pop-up clinics, walk-in clinics, mobile clinics, Encore, community centers. So it'll become much more granular, if you would, going forward to really continue. We have to bring vaccines to people where they are. And on Sundays, on evenings, after churches, after mosque, and be just much more flexible as we go forward now to really reach those communities that we've not yet reached.
So I really appreciate you responding to this, and you and I have had many conversations. I've been one of those people who have both behind the scenes and in front of the scenes. And if I have to go on Twitter to communicate, to say, you know, I've been concerned about the mass vac sites. They clearly served a purpose, right? But I also have always worried, and I know that this is who your life's career are. So the great thing about having you at the helm is I have always been confident that I know who you care about, not because you tell me, because you have an incredible career of focusing on communities that are important to me. So, but the challenge here has been, we know that people need to get vaccines from nearby. They need to be convenient. They need to be from people that they trust and that they feel safe in that delivery. So when you talk about Encore, if you don't know what Secretary SUDDERS is referring to, is that the Cambridge Health Alliance applied to be a regional site, was approved, and they just opened up last Tuesday, where Encore has partnered with the Health Alliance in Everett, providing buses to people to get there who need it, as a more regional site in the heart of a part of our state and our neighbors who've been hit really hard, right? So this is exciting news for us here locally. And I think, and people are hearing it right now. They're hearing it again, breaking news, that the state is going to start moving away from these mass vac sites, and has heard and understood and has now more bandwidth and vaccine to do it in ways that really are about meeting people where they're at and where they need. And I say that, you know, whenever I've been in conversations, I hear people talk about vaccine hesitancy, and it's always been really important. And I've heard you, Secretary Sutter, say this, like, we can't talk about hesitancy if we don't first talk about, well, what are the obstacles and concerns why people don't just not get them. It's who's giving it to them, where do they get it, what's the information, and when you can start actually working through those obstacles, it's not that they're hesitant, people are thoughtful and scared. And when they get that information, then they're making different choices and actually get the vaccines into their arms.
I think the other thing I would just say then is we also just, barriers, real or perceived, have to be removed. And I think what you will also see, and I know this is true, is more walk-in clinics. Now that we have 2/3 of the Massachusetts population over the age of 18 has had at least one dose. Like, so we are really, and today we have administered 6 million doses in Massachusetts. So, we are really we are really moving these out. And so now it's like, what are the other barriers that we need to just remove? And I think you're going to see walk-in clinics much more. I don't like the term pop-ups, but temporary clinics, community centers. I've gone to some churches in Mattapan where there's a food pantry, as Bishop Border has said, come in one door, you get your groceries, go out the other door and you have your vaccine, and come back on Sunday for church. This is what we need to do as a community together, but we just.
Well, this is great to hear. And for those of you who are watching us, you should just know that you're hearing stuff that has not been announced yet. This is the kind of stuff I would get on a weekly legislative update call. So it's pretty exciting if you're watching us to hear this before it's out there. This has been our hope, and this is what we believed would happen. It's happening. So I want to thank you for all of your work there. I'm going to just jump into, and I am going to say, especially when it comes to vaccinating children and adolescents, it's going to be more important that the accessibility exists, that bringing a child to a mass vac site is not going to work, right? So I look forward to that conversation. And I also happen to chair the Joint Committee on Public Health. So we will, as a chair, I will be talking more about this to you, the administration, and to the state about how this works. I'm going to, let's see, given vaccine hesitancy and drop-off in a number of U.S. states, has Massachusetts considered reinstating stricter COVID travel rules for testing and quarantine? So this is, we're really proud and thankful both at the same time to live in Massachusetts. And I'm also thankful to live in Cambridge, right? There's a lot of privileges that are not fair. Cambridge has 7 days a week testing, right? The Broad has been an important part of that. CHA has been an important part of that. And the city of Cambridge has been important. 7 days a week, no cost, no questions. We don't care who you are, just come in, get your test, and give us an email. And that has absolutely saved lives. But that's not enough. It's not okay that that's just for people of Cambridge, right? We've had this has to be everywhere in the state. And it's not okay that just Massachusetts is doing a good job at our vaccination rates. We now know, if we ever thought before, we don't live on an island. And not only do we need states across the country, we also have to be important partners globally. So what are your thoughts on how we manage this when other states might not be as ready and eager as we have been here in Massachusetts to do this?
It's a big question on multiple levels. I think, what we know is that this virus knows no borders. And so whether it's in guidance or legislation or just on personal decisions, to be vigilant about how we're moving around and who we're interacting with, to the extent that we can. And it's all the more reason to maintain personal protection, including masking and distancing, if the rules and the behaviors don't afford us that protection from restrictions on travel. We need to do it for ourselves. And so I'm sure others have thoughts at the higher level, but it's just another plug for those steps we can take as individuals.
Well, I would absolutely build on that and sort of maybe synthesize Dr. MacInnis and Dr. Sayah's comments that, the way we protect ourselves is by protecting ourselves. And so going out and getting vaccinated is just so important because that is such a powerful action for your own health and the health of our community here in Cambridge, here in Massachusetts. I think the other thing, and I don't want to be, too syrupy about it, but there's a lot of ways we can serve as an example. If you look at how successful we've been with the vaccination campaign, with the changing rates of infection in our communities, one hopes that what we do well here can serve as good motivation for other parts of the country. And basically, the more we save lives here, hopefully, the more that can extrapolate to saving lives elsewhere.
I totally agree. And also, you have to remember that the world is very small, and it's getting smaller by the day. And part of the reason that we got here is the world is very small. So we have to remember the lessons that got us here. And yes, as we focus on the region and the state and the country, we have to also pay attention to what's going on around the world. Because we all agree that the rest of the world is far behind the United States and a lot of other countries regarding vaccination and access to vaccine. And we cannot beat this pandemic alone. It's going to take an international effort to beat the pandemic. And we have to really pay attention not only to the first world and second world country, but to third and fourth and others that really live in difficult environment and difficult situations and high density and no access to a lot of personal protective equipment and distancing and you name it. We need to get this vaccine, the vaccination done everywhere. Because yes, we need to start with ourselves and our neighbors in our neighborhood, in our state, in our country. But at the end of the day, we have, in order to beat this, we got to have a really coordinated international effort to get this done.
You know, I think this is where this administration, President Biden and Vice President Harris, of really using the science, not just in the United States, but now, of course, you know, reaching back into the world stage and health. And I do think, you know, I don't have an easy answer on travel, but I do think this administration is not only acknowledging like the really good work we're doing in Massachusetts on vaccines, but working with states that are really struggling with vaccine administration rates and not ignoring them, but really reaching out, partnering, getting best practices from what some of us are doing to extend them to other states, but then, you know, really extending now globally as well. So I think that President Biden and Vice President Harris and the administration, the federal administration, you know, is not going to be isolationist about understanding we all have a place, you know.
Yeah, I think we're all breathing a little deeper and easier under this new administration and, you know, leadership, compassionate leadership. So I'm going to ask two quick questions, and then I have something I'm going to ask each of you to think about as we wrap up. So what are we doing around data collection for people who have gotten vaccines? How are we keeping track as a state? Are we keeping track? And a really practical questions. What happens if you lose your vaccination card? Where do you go? What do you do?
So on the data collection side, on the research, I can say that you know, all of the research trials for Pfizer, for Moderna, for Johnson & Johnson continue to follow their research subjects and will for years. So they're doing repeat blood draws. They're keeping an eye on how many folks get infected, whether they're infected with an existing strain or a variant strain. And again, back to variants, when people do have what we call a breakthrough infection. So as Dr. Sayah said at the beginning, it's possible to get infected even though you've been vaccinated, but it's really rare. And so again, if you get vaccinated, your chances of getting infected are much, much, much lower than they would have been. And then your chances of getting hospitalized or dying are incredibly small. So it's really important to remember why we're getting vaccinated, which is let's prevent the worst outcomes, which are getting hospitalized or God forbid, dying. But if someone does have a breakthrough infection, we are trying to keep a really close eye on those folks, look at rates of breakthrough infections and look at variants. So far, again, back to the variants, we have not seen differences that people who have breakthrough infections are more likely to have variants. That's really encouraging news for the protective factor about vaccines. And then we're looking at how long immunity lasts. And so we'll continue all those studies, all that research, and thankfully, just the scientific establishment is just pouring out data that will help us make good choices.
Absolutely, yeah. And I think I just want to add, I mean, absolutely what Dr. Bittinger said is true. We're working in the research community, working with clinical teams and public health teams and doing the testing and sequencing to make sure we understand when there is a true breakthrough infection, learn all we can from that and pool that data, because these are infrequent. pooling that data with other groups across the state, across the country, and around the world to make sure we have, as much information together to really understand what's going on. I did want to mention that I'm curious if the others on the panel feel the same, but I just anecdotally feel that I hear quite often angst about anecdotal cases of breakthrough infections. Some so-and-so had the vaccine and tested positive. And I just want to remind everyone that that is not necessarily at all as scary as it sounds. That does not necessarily mean that the vaccine failed or that our vaccines are failing. This can happen. Often individuals only have one dose when this happens, and they do continue to be more susceptible to infection after only one dose, of course. And even if it's after one dose or two doses, it's often very, very low viral load infections. So low that we
I think you froze.
She might have froze. Oh, sorry. I was about to finish your sentence, but you should do it for yourself. Since
okay, well, yeah, I think you probably get where I'm going. That don't worry when you hear these stories. That often there's a very good explanation that isn't as scary as it sounds, and that we're working hard to find if it does arise where we do need to be concerned and to act accordingly.
Great. And then I have another question related to this. And then I do want to get to the question about where do we go if you lose your card. So somebody texted in from the chat here. I got the J&J vaccine on April 12th, and my record card states that it expires on June 21st. Do I have to get another vaccine in June? Similarly, my husband's Pfizer vaccine expires in July. Does he have to have another one then? Thank you.
Yeah, and I'll take that quickly. I typed a response. I think, forgive us, because I'm sure we just didn't do a good enough job communicating. Expiration dates have to do with when we need to give the vaccine to a person. So it's sort of like an eat your steak by this date when you get your food at the grocery store. And once it's been administered, that date's no longer relevant. So the person that typed in and the husband are definitely good. You got your vaccines before the vaccine had expired, which is the way the system works. What we don't know is how long the immunity will last, and that's part of what we're collecting data for, but nothing to do for the person who texted in or the husband. You're good going forward.
Great. Secretary Sudders, I've lost my vaccine card. What do I do?
Administering providers, I actually had to double check as you were asking the question. So administering providers and vaccination sites can create a new record card for the recipient. So if
what if
you
they no longer exist? The place that you were vaccinated is gone.
But there is a, so you know what? Here's what I'm going to put up on mass.gov on the vaccine, on our vaccine website. I'm going to put up FAQs for what happens if you lose your card. My first and second thing is don't lose your card, take a photo of it.
Yeah.
But if you do, I will put up some FAQs on mass.gov vaccine.
So take a photo of it, send it to your own primary care doctor and ask them to put it in your file. That is what a nurse at CHA shared with me, but I got mine at the place that my provider is. But I thought that was a great idea too. So thank you for that question. You just impacted and influenced. Secretary Sutter is going to put up a whole nother page to answer this question. We are running out of time. So I want to first say again, thank you to all of you. Thank you for the work that you do every day to really, I get to chair the Committee on Public Health, and I've been talking about public health really is the nexus, that intersection of ensuring that social determinants do not predict that you will have worse health outcomes, which often they do right now. We know systemic racism and economic inequality often will be the greatest threats to your health outcomes or our health outcomes. And many of you in very different ways are working to ensure that that's not the case. If you have medicines and vaccines that can keep you healthy, you will have a better chance at a much more thriving life health-wise and economically, right? I mean, it's just, this is all interconnected. I want to say, if we can just go around, if you could do 30 seconds, and it might not be possible. I remind people that when they think life is never going to go back to what it was in 2019. I say, well, I don't think life went back to 1917 after the 1918 Spanish flu, but I don't know what 1917 looked like. So I'm not really mourning the loss of that life. And you know, I see it as a transition. I already know that I am fortunate, and I acknowledge that life feels a little bit better and safer than it did a year ago, in terms of how to even maneuver. I'm no longer. Hello?
We can see you.
Oh, my Zoom just went down. Anyway, so that I can, that was odd. I can't wait till this isn't life anymore either. Some of it will still be good. But anyway, just to say that I can already see, if we're lucky and we have certain, you know, life is already a little safer. I'm not scrubbing down my with Clorox and wearing a mask and thinking I'm going to die of like inhalation from bleach on my groceries. I wear one mask going into the grocery store now that I'm fully vaccinated, and I feel a lot less stressed than going into a grocery store, right? So I do think it's going to be this easing forward, but it's probably not going to look the same. But that doesn't mean that we're going to necessarily grieve the complete loss of life. It's just we're going to move, and we're going to get back to a life that feels a lot more connected and thriving. If you could say, just quickly, I'll do this rapid, and I'll start with you, Dr. Bittinger. You know, a year from now, what does life look like? And you're based on where we are with the science and the public health protocols and resources.
I think a year from now, we know much more likely whether we need boosters, but we've developed public health systems that can develop them and keep us safe. I think we are gathering in our homes comfortably with friends because we've been vaccinated together. We're comfortable, we feel safe at work. And on the health side, it maybe is a little easier to see your doctor because we have better telemedicine systems that allow you to get easier visits. And to the point you made, I think both the healthcare system and public health system are much more actively aware of the role of health equity in patients' health overall. And we've made significant improvements in addressing the health disparities that we've so terribly seen during this pandemic.
Thank you. Dr. McGinnis? I think your screen is frozen, so I'll come back to you. Secretary Sudders, what does life look like a year from now? Maybe you'll have just like, instead of 20,000 jobs, just like 10,000, but.
I look forward to walking down streets again and people being able to smile at one another, not assuming what it's behind a face covering, and be able to walk by someone without someone being fearful and hopping out in the street because they're just terrified of walking by you on the street. Honestly, I look forward to just the social interactions, the informal ones that all of us have missed in just that genuine way.
Me too. Thank you. Dr. McInnes? Oh, I think we lost her again. Okay. Dr. Saya, what does life look like a year from now?
I agree with what's been said. Also, I'm looking forward to our kids having a normal life and their ability to go outdoor and play. And really, because that is an absolutely critical part of growth and development, being in school and having those social interactions are absolutely critical to their growth. They did miss out a lot last year. We tried to compensate as hard as we can, but they did miss out a lot, and they need to really catch up. And I hope a year from now, they will be out there and they can be normal kids. Although, you know what, these days normal kids are different than my age. I mean, they're still stuck to computers. That was easy to transition from.
Mine has been in the background screaming, and I know that it's probably being heard here, laughing and playing online. So
see, but we need to encourage them to be out there, to be normal kids, to have those interactions, to have the growth. That's absolutely critical. And also, I'm hopeful. Also, a silver lining is that the lesson we learned, they're not completely forgotten. The lesson we learned on how to protect ourselves, how to protect our families, how to make sure that we don't have a flu pandemic every year of tens of thousands of people dying. We didn't have one this year because of what we did. So there are some lessons here that we need to learn. There are also some lessons that we need to learn because this may not be the last time that a pandemic happens. And I think we can all agree there was an opportunity to really recognize, respond, and act differently. And maybe we can learn those lessons moving forward.
Thank you. And Dr. McInnes?
Am I here?
Yes. What does life look like a year from now for you?
Wow. Well, I mean, I'm just looking forward to being back to some kind of normalcy in Cambridge and Somerville. I look forward to going to movies at the Kendall Theater and eating, dinner in our amazing restaurants and just, markets and all of the social things that we have been missing all along. And I think I just want to remind us that I hope next year that we're continuing to support our communities who have really suffered through this. I think even if cases drop and vaccination goes up, there's a lot of grieving and a lot of rebuilding to do. And so I hope we're focusing on that together in a year's time.
Thank you. I will just say quickly, I look forward to life evolving over the next year. I look forward to not losing the lessons of what systemic racism and income inequality. It didn't have to be the disproportionate impact, and the life that was lost on our most vulnerable members of our community. And that was not a coincidence. It really is because of systemic racism that has been unchecked in our healthcare, in our economy, in our education, and just our everyday way of life. So I'm hoping this kind of incredible awareness, which has come at a huge cost and toll of life, and it seems like we are, I can say, in the legislature and hopefully nationally, really taking a hard look at that so that we build resiliency everywhere. And I look forward to having kids in school. I look forward to really over the next year, some of the big work to be done is addressing the mental health impact. Nobody has survived this without feeling the mental health stress of this, but we are experiencing a crisis with children and adolescents right now. So I look forward to a year from now, maybe that we've made a lot of progress in the next 12 months and really focusing and giving that as much energy and attention as we have given to the fears of trying to keep safe from COVID. And I look forward to seeing all of you in person. And, I'm a hugger, so it's going to be hard about whether or not that's going to happen or, if it can ever happen in that way or more selectively. But I just look forward to connecting with people in real life. But I look forward to more people feeling safe and being safe and healthier. And I thank all of you. I want to thank my amazing staff who has been on here helping me. The people of Cambridge, I only get to do the work that I do for you because I have amazing people working for me. CCTV, as always, you are helping us connect in the most important and profound ways. And to the people of Cambridge, you're amazing. You have been working so hard to not only keep yourself safe and your family safe, but you've been working so hard to keep us all collectively safe. Social distancing, wearing masks, supporting each other, supporting communities, neighbors, and programs that have been really trying to uplift those who've been really traumatized and devastated by the impact in all of the ways that it has. Thank you, Cambridge. Keep it up. We're going to get there, and I'll see you all hopefully in person, and maybe we'll do this again. Thank you.